This week on Thoughtful Thursday, brought to you by General Practice Solutions, Cameron shares an exciting story. The NHS has just launched a £10 million neighbourhood health services programme, stretching right across England from Cornwall in the south to Sunderland in the north. It's an ambitious plan designed to bring care much closer to people's homes, so that healthcare isn't something distant or hard to reach, but something rooted in local communities. The first focus is on long-term conditions that affect so many of us: diabetes, high blood pressure, arthritis, and similar chronic illnesses. These are conditions that require not just one-off treatment but consistent, ongoing support. By building neighbourhood teams, the NHS hopes to give patients that continuity and to stop people from falling through the cracks between different services. What does that look like in practice? Instead of having to juggle separate appointments with your GP, a hospital consultant, a pharmacist, and maybe even a social care worker, the idea is to create one joined-up pathway. Local teams will include GPS, hospital doctors, nurses, pharmacists, social care staff, and even voluntary organizations, all pulling together in the same direction. That kind of collaboration means fewer repeated tests, smoother referrals, and most importantly, care that feels human and coordinated. Looking ahead, there's another layer to this transformation. From 2026, new neighbourhood contracts will be offered to GPS, covering populations ranging from 50,000 up to 250,000 people. These contracts are meant to underpin the shift, giving practices a clear framework and funding model to work in partnership with other services. It's a scale that's big enough to bring in specialist expertise, but still small enough to keep the care personal and rooted in local life. The broader ambition is simple but powerful: to reduce the need for patients to travel long distances, to strengthen prevention so conditions are managed before they escalate, and to make NHS care more accessible and responsive. By situating services right in the neighbourhood, the hope is that people will get help earlier, avoid unnecessary hospital admissions, and feel more supported day to day. It's early days, but this £10 million programme signals real intent. It's about moving from a reactive system to a proactive one, where communities become the heart of healthcare delivery. Imagine a world where the people looking after you already know your circumstances, your family context, and your ongoing health journey, and where your appointments aren't just transactions, but part of a wider, thoughtful plan for your well-being. That's what this neighbourhood health services programme is aiming for. A more joined-up NHS, closer to home, and better prepared for the challenges of the future. Thank you for listening to Thoughtful Thursday. Join us next week, when we'll share another story shaping the future of care.